Today, here and now, this is the first NNN Conference post this youth side event, right here in Dar es Salaam, where Youth Combating NTDs was launched in this very same venue. We are all here in this NNN 2023 conference to engage in dialogue because of our desire to work towards an NTD-free generation. And youth are central in that fight to end NTDs. What is also of significance is intergenerational collaboration, combining the dynamism of youth and the experience of the older to achieve significant progress in the fight to end NTDs. This youth-led panel discussion at this year's NNN conference is testament to the fact that young people are important stakeholders in discussions to prevent and eradicate NTDs. The title of this youth-led panel is Demand Generation, the role of youth in creating a movement to end NTDs. The discussion is going to feature young advocates and practitioners with expertise and experience in the field of NTDs. Each of the panelists will share their perspectives on NTD-related issues. We hope that this panel discussion will enlighten, empower, and equip you as leaders to be positive change agents in the movement to end NTDs. My name is Mary Jean. I am from Botswana. I have a legal background, and I am one of the advisory board members for Youth Combating NTDs. I'll be one of the moderators in this panel discussion, along with my co-moderator, Dr. Joachim Mabula, who's over there. Now, I would like to welcome to the stage Louisa Tribe, who will give the opening remarks. Louisa Tribe is the Director of Communications at Uniting to Combat NTDs. Louisa, over to you.
Hi, everybody. So my name's Louisa Tribe, and I'm the Director of Communications at Uniting to Combat Neglected Tropical Diseases. And in case you don't know us, we're a global advocacy organisation that exists to end neglected tropical diseases by mobilising resources in support of the World Health Organization's NTD roadmap and the Sustainable Development Goals. We're really delighted to be supporting this important panel discussion entitled Demand Generation, the Role of Youth in Creating a Movement to End NTDs as part of the NNN Conference this year. So, why is this topic really important? First, youth leadership is an end goal in itself. Young voices must be at the decision-making table. Young people are disproportionately affected by NTDs, and as current and future leaders, it's vital that the voices of young people are heard. Second, demand generation and movement building are critical tools in advocacy and resource mobilization. We need to increase awareness, we need to increase saliency, political will, and propensity to act in order to unlock financing and action for neglected tropical diseases. So, how do we ensure that the fight against NTDs and the excitement about eliminating, controlling, and eradicating these diseases is at the tip of the tongue of decision makers? And how do we ensure that not are only young voices heard, but they're also listened to and acted upon? One way is by supporting young advocates that you'll hear from today and vital youth-led campaigning organisations like Youth Combating NTDs, who have organised this session with the NNN today. Another is by holding youth-led discussions just like this. So without further ado, I'll hand back to our esteemed moderators to kick off the panel session. Thanks very much.
Hello, everyone. My name is Dr. Joachim Mabula. I'm from Tanzania. So I work as a medical doctor, and I also work as an advisory board member for Youth Combating NTDs. So what we are doing with Youth Combating NTDs is to amplify the youth voice in combating NTDs. So we do advocacy, we also influence financing on NTDs programs, and also WASH programs. And I'm here to introduce the panelists who are from different countries. And the first one will be Hooria Amiri, who is a youth advocate and a youth champion for youth combating NTDs. And she's from Pakistan, and she has been recognized internationally for her work in raising awareness on NTDs on various platforms, including digital platforms. And also, she won a global youth NTD storytelling competition in 2021. And the other panelist is Ambakisye Mhiche, who is from Tanzania. He's a public health specialist and applied epidemiologist. And also, he served as a senior program officer for RTI, which is Research Triangle Institute, famous known as RTI International. The other panelist is Yuya Kondo, is a medical student from Japan, and also he worked as an administrative officer for NTD Youth Organization from Japan. He has participated in various forms of NTDs advocacy, including lobbying governments to improve the research and funding in the field of NTDs. I'm going to welcome my colleague, Mhiche, to continue with the. Okay. So the final panelist is Dr. Baral. He's from Nepal, and also he works for Leprosy mission in Nepal. And he's a consultant dermatologist, and he's been working in NTDs for more than 2 decades. And he's one of the only 2 dermatologists in Nepal. So for those who don't have a medical background, the dermatopathologist is the doctor specialized in diagnosing and treating skin conditions, and they also do deeper research in the laboratory. Thank you.
Well, to kick things off, as a general question for our panelists, it is an established fact that young people play an important role in creating a movement to end NTDs. As a starting point, and based on your experience, why do you think this is the case? Why do young people play such an important role in combating NTDs?
The skin NTD. So since 2014, I've been working as a consultant dermatologist and dermatopathologist. When I entered, when I entered in the field of NTD, I was young, but maybe not now. So the role of in any field, the role of youth is very vital in the transformation of anything, any movement or any sort of big things are carried by youth. So in the field of, and especially in the field of NTDs, there are not much youth attracted to the field of the NTDs, because it's not that, what we call, not that glamorous and not that financially rewarding field. So nowadays, most of the youth, they try to go to the field which is more glamorous, which is more recognized, and not in the field like the NTDs. But the need of the youth in the NTD is very high, because once we enter in the field of NTD, then we realize that how much need is there. Because when I started 10 years back, I was thinking I will do only for 1 year in the field of leprosy. But when I entered in the field of leprosy, then it's the time goes by very, very fast, and I feel the need over there, where I can be some help to the patient and to that community in the field of leprosy. Thank you.
Thank you, Dr. Baral. Hooria?
Thank you so much for having me. Starting with youth, I would say that youth actually comprises of almost 25% of our world's total population. So it's not possible to achieve our goals without including the most potential part of our society. As youth, we are the most up-to-date generation, living in the most recent challenges. So in NTD landscape, youth not only brings energy, but also fresh perspectives and innovative ideas. Additionally, I believe that we, the youth, we are the generation who are directly impacted by NTDs. We are the generation who are directly impacted by the new interventions that are introduced in this landscape. Because we, the younger generations, will be the ones who will be living in the decisions that are made today. So we should be the ones present on the decision-making table, taking necessary action for our collective future. Additionally, most of the staff that we are having in our NTD landscape is the senior staff approaching their retirement ages. So there must be a well-equipped force behind them to accommodate that gap, which is youth. Therefore, the involvement of youth is critical in the fight against neglected tropical diseases. Thank you.
Thank you, Hooria. We sense a lot of passion coming from you. Yuya?
Hi, I'm Yuya. Thank you for inviting me. As they introduced me, I'm still a student, so I speak from perspective of students, so, be kind to me, please. The field NTD is extremely niche, I guess, and I believe it is overlooked by many people, I think. In fact, even the doctors or infected patients doesn't know about NTDs. And I believe that it is the role of young people to make a breakthrough for this situation, which is like to open a window for understanding of NTDs. In other words, our role is to make this existence of NTDs, which is like unknown entity, to be comprehensible and acceptable one. Thank you.
Thank you, Yuya. And Ambakisye?
Thank you. I think the colleague has said most of them, but we must acknowledge that as we are here right now, the largest workforce in the NTD field are the youngest population. And taking into consideration that most of the NTDs endemic countries have the youngest population, so there is no way that you can escape youth in driving the agenda towards elimination. And take an example for the community mass drug administration, where we consider much on the impact which CDDs bring into the program. And taking a closer look on the CDDs, most of them are the youth. But how much and how often do we acknowledge their contribution to the ending the NTDs? These are the people who are actually working at the lowest level. And these are the youth that we need to acknowledge them. That's why As we are here as youth, we need to take that full advantage and bring these people who are actually at the field to that level where we really need to acknowledge their contribution, because they are already in the ground driving the movement towards NTD. We just need to amplify that effect and make them the real seen and have the courage to move forward. Thank you very much.
Okay, thank you, Ambakisye. So when I was introducing Hooria, I said that she was a winner for storytelling, and I have a question for her, and it goes like, there was competing priorities in health sector. By the end of 2019 to 2021, for example, there was a COVID pandemic, and in the health sector, the priorities were shifted. And so what is the importance of using storytelling in mobilizing sustainable action for action towards ending NTDs?
Okay, so I believe that when we communicate, especially in advocacy, it's vital to craft messages that not only engage but also inspire action. Therefore, I believe that storytelling in particular is one of the most potential tools we have in our arsenal. And as a storyteller and advocate myself, this resonates deeply with my own journey as well. I believe that like in the past 2.5 years of my advocacy, I have actually observed and witnessed the positive impact storytelling has created in my advocacy. This is due to the fact that storytelling has this ability to connect with people. It transcends beyond complexities and statistics. And believe me, it truly transcends beyond boundaries and borders, making complex issues like neglected tropical diseases more relatable and more easier to understand by the common man. So now, how we can ensure its sustainability as health sector priorities evolve. First of all, I believe that storytelling is incredibly adaptive. It can take various forms, whether it be text or videography or music, as we have witnessed in Global Youth NTD Storytelling Festival by YC NTDs as well. So this adaptability is the key. As health sector priorities evolve, we must be ready to transform our storytelling to realign with the changes. Secondly, we must integrate storytelling in broader health sector agendas and consider cross-sectorial collaborations, because as health priorities shift, cross-sectorial collaborations becomes more critical. And third of all, to really ensure that our message keep rolling and our efforts will not go in vain, we must mentor the next generation of storytellers as well, because right now as we are advocating, there must be a force behind us that can carry the torch forward. So in terms of sustainability, I believe that storytelling is not just a one-time thing. It's a living force that propels and adopts over time. So yeah, thank you.
Thank you, Hooria, for your contribution. So my question turns to Dr. Baral, who has a decade of experience. So I would like to know, what would you say the best strategies to use to train, inform, and get participation of young people, especially in rural areas?
Thank you. Thank you, Dr. Mabula. NTDs are the diseases of the rural areas, so the participation from there is very vital. And especially, NTDs are not the disease that it can't be eradicated just by treating the disease itself, because I have been doing that for the last 10 years, and what I have realized that we should integrate just by treating the disease, we can't eradicate the disease or eliminate the disease. We have to consider the other factors like the One Health system also. And if we can include those systems into the school health curriculum, then we can engage youth as well, so that they become the part of the training, and then they can be mobilized to in the future. The children now are the future, the adults in the future. So if we train them in their childhood in their curriculum about the NTDs and like the One Health or the all the ingredients, then it can be they can be a very good leader in the future. So they can think rationally, like our health is not only dependent on us, but it is dependent on the environment and the animals as well. So that's the one way of combating entities, like incorporating it into the school health curriculum in the very beginning. Thank you.
Thank you, Dr. Baral. So we hear including training students in the curriculum as one of the best strategies, and then from Hooria, we're hearing storytelling as a sustainable method. Yuya, I'll turn now to you. How can the NTD community get more young people involved in different capacities, from advocacy to policy making?
Yeah, I think providing opportunity is the important thing, and the opportunities should be like organizing conference or webinars, workshops like this, which are youth-centered. Actually, speaking up among these all adult experts is really challengeable for youth, which is a very thing that I felt in the day session. But if the conference is for youth, they can speak up and they can express their what they think or what they have for ideas or what they recommend for policy making. So I think providing opportunities is really important thing for youth-centered. To make young people get into NTDs.
Thank you, Yuya. And Ambakisye, what are the main barriers to participating in national and international platforms fighting NTDs?
Yes. Despite the current youth involvement in the fight against NTDs, I think one of the barriers that still exists among them is getting their voice heard. They haven't yet penetrated through the system to be able to raise up their voice and be part of the decision making, and therefore I think that is one of the factors that hinders them. And when you go further, like even in the interventions, like when you are designing the intervention, like the advocates, we rarely think about the youth. So we always think about the political leaders, we'll think about the cultural leaders, and we'll think about other special groups, but we normally forget there is this huge group of youth that if we reach to them and let them understand what is going on and what the impact of NTD in the community, so that they become part of the solution, despite being part of like this, they amplify being part of the solution. I think it'll be much help, but currently I think that's what is lacking, linking them to the policymakers, being part of the decision, but also reaching out to them in the advocacy and sensitization package. We normally forget them and leave them aside, but this is a barrier for me, and that needs to be addressed.
Thank you, Ambakisye. Now we will turn it over to the audience Q&A. If you have a question, just raise up your hand and we will take your question. Just say your name and which organization you represent. and then direct your question to a panelist if you have a panelist that you would like to answer your question. And if it's general, then you can say so. And to all those that are joining virtually, if you have a question, you can type it in the chat, and we will try and get your question through as well. So, questions?
Thank you. Good evening, everyone. So my name is Amiri Msagama, and I'm the team lead of One Health Society in Tanzania. It's also a youth platform. So it's not a direct question, maybe not to you, maybe to anyone in this room. So we have seen this is the second youth event during the NNN conference this year. So the one yesterday and this one, and they are all very promising, and the youth show energy in what we want to achieve to complement the global efforts in NTDs. So I was sitting here thinking, can we, or if possible, having a global youth network within NNN platform, so that we can be mentored, guided through the NNN NGOs platforms, so that we can be the actors, the future generation in this eliminating efforts. So it's more of a contributional request. Maybe if we can think about it in the future. Thank you.
Oh, okay. Thank you for your contribution. So we have Youth Combating NTDs, and you can collaborate with us. If you have ideas which will lead to elimination of NTDs, we are happy to collaborate with you. So you can search us online through Youth Combating NTDs on all social networks, also on the website. Thank you.
Evening, everyone. I forgot what I wanted to ask. Okay, my name is Sydney. I am an occupational therapist and youth advocate for NTDs. So my question is for everyone on the panel. Recognizing the complexities you mentioned, for instance, exclusion of young people, shifting of priorities. I know climate change, what else? Lack of awareness and understanding of NTDs in general. I wanted to know what gives you hope for a brighter future in the fight against NTDs as young people.
Thank you for your question. So Hooria is going to answer your question.
Thank you so much for asking. You have asked what keeps us going in the fight against NTDs, yeah? Actually, it's our vision. We have the vision that we'll become the generation to end neglected tropical diseases in our lifetimes. As a youth advocate myself, when I look at the future, I envision a future for NTD advocacy where the younger generation, transforms and builds up a transformative force to advocate about neglected tropical diseases on a global level. More NTD youth advocates and more youth leaders bridging the gap between innovation and technology and community services. If we truly want to excel in this fight, we want to make this NTD landscape more inclusive and more dynamic, with more younger people and more women in this fight, collaborating across sectors. Because the thing that you've mentioned, climate change and NTDs, it resonates deeply with me as well. As youth advocates, we must realize that NTDs are not isolated issues. They are linked to broader challenges. And I actually believe that we as young people, we are already witnessing the growing influence of younger generation in major global events, including like COP, etc. So it's evident that we are actually engaged in shaping these policies. Now it's upon us. It's our duty to, consider to give neglected tropical diseases the center stage and the attention they deserve in these major global discussions while discussing poverty or, women rights or climate change. Discuss about neglected tropical diseases as an integral part of the puzzle. So yeah, by building on this momentum and by advocating in these cross sections, we can actually work towards elimination of NTDs. Thank you.
Thank you, Hooria. Another question?
Thank you. My name is Ahmed, and I am from the Mission to Save the Helpless. My own contribution would also, of course, be a complement of the last comments you made. It's about the inclusion is happening. It's happening. The advocacy is strong. We have Yuya here who is doing great. But I feel we need to be more strategic about our inclusion. You mentioned the point now, which was actually part of what I wanted to say, about participation at high-end mid levels, like being part of committees, being part of working groups, being part of the MDA process going on in the communities, beyond advocacy. So what I see most times, I'm also a youth anyway, is more of advocacy. Youth are engaging in more of advocacy, talking about NTDs, but there are more to, in terms of the activities that goes behind NTD-related activities. So we have the MDAs going on in communities, we have working groups, we have meetings like this. We need more inclusion of youth in some of these meetings. Then we also need inclusion of youth in the NGDOs. We have several NGDOs. How many of them are taking up youth? How many of them are building their capacities? Do we also know about what the CDDs are doing in the field? Do we know about what the FLHs are doing on the field? So we want this, the NGDOs to also take up youth. For example, my side is taking up a lot of youth. We have a kind of a thing for building capacity of very young people who are undergraduates, like teaching them about MAM, teaching them about MDA and all that, because we need a lot of people in this fight. That is the truth. You need a lot of trainers. So we need to be strategic about this inclusion beyond advocacy. So probably think about other measures. Thank you.
Thank you for your contributions. Another question?
Hello, I'm Subin, I represent the Leprosy mission. My question is more to Yuya. Youths, we sometimes struggle to be taken seriously, and you've done a lot of work in advocacy. I want to sort of draw from your experience and see were there issues on being taken seriously as you advocate about NTDs because it's such a subject, and how did you overcome those issues? Thank you.
Thank you for your question.
I'm sorry, will you ask me a question more kindly, please? Because I couldn't understand the point, sorry.
Yes, so I wanted to see if there were issues where if there are times where you struggled to be taken seriously because you're a young person and you're advocating on NTDs, which is quite a, yes.
Maybe the big issue is, the name of NTD is neglected. In my country, Japan, almost 99% of people doesn't know about NTDs. And they don't think NTD is gonna be a problem for our country. But as COVID-19 showed us, that's not true. And maybe in 30 or 50 years, Japan, as the climate changes, Japan's gonna be a target of NTDs. So we have to advocate for them. But they're like, I don't know how to say it. Their position towards NTDs is a big issue. So what we can do for it is just to advocate, and that's why I came here. Maybe only me and one Japanese just coming here, like here. So I want to learn everything from you guys, and I have to tell Japanese people what I can do and what's the deal. I think that's a way to overcome the issue. Thank you.
Thank you, Yuya, for your contribution. I'll take the last question. Okay.
Thank you very much. My name is Kofi Nyako from Ghana, and also a member of African Alliance. When we are talking about youth, sometimes I ask myself, are we forgetting those from African youth or not? Because some of the African schools learn something about technology, but most of the children even have not seen computer before. When you go to the rural areas, some villages, there are even not electricity. They still use lantern. Everything is on WhatsApp. Everything is on our website. These people, they can hear, but there is no access for them even to access that particular website. Please, what are we going to do for this youth also? Thank you.
Thank you, Kofi, for your good question. Dr. Bara, can you help us?
I think it's a very difficult question because the thing this is the problem with the developing country and even the poor countries even like Africa and in Nepal also there are the times when the basic education to the children are not provided. So that's a different fight than this. But as I mentioned that those are the communities, those are mostly hit by the NTDs. So it is very vital to, like, if they are going to the schools and if we can develop some curriculum that can be taught to them in their schools, then that will be a better way. But there are times that they may not be able to go to the schools. So that's a serious issue.
Thank you, Dr. Bara. Dr. Mhiche, can you respond to the same question?
Thank you. I think he raised a very important issue regarding the youth who cannot access the social media platform. So this comes to the way we design our community-based approach. How are we inclusive to this kind of group? So that's where we can't do different. Like whenever we are planning and developing and implementing the community-based program, we need to take into consideration these youth that we are going to target through this, like one-on-one, like the physical mobilization campaign. For instance, when we are going for like the MDA campaigns, or like for the MMDP services, like when we are going for the like hydrocelectomy or TT surgery camps. How do we design and implement the community mobilization approaches matters a lot in reaching out to these youth who cannot access the social media platform, of course, which are very many in developing countries, in the villages, and where actually these patients are, and probably part of the people who are actually suffering from the disease could be the youth. So I think we need to use the sandwich kind of approach. Yes, leverage the technology through the social media platform, but also having something different, which is physical, and we can go, we can interact directly with the youth and take them be part of the solution.
Yeah. Thank you, Mhiche, for your contribution on community engagement. So since we started a bit late, so I will take the last question.
I think I would want to contribute to the question rather than asking a question, like how you can involve youth at the grassroots level in access to it. Sorry.
Yeah.
So my name is Michael Ofire. I work for Amref Health Africa, and also a leader in the Kenya Youth Against Neglected Tropical Diseases. So I think we have a question that has been asked for youth that are coming from the remote areas. And we know NTDs largely will be found where the road ends, yeah? Where we have no network connectivity, we have no roads, we don't have, electricity and all those, yeah? So someone asked, like, how do we ensure that we get to, the youths in those peripheral areas? So I'll just share Kenya's experience. So when the Youth Combating NTDs was launched, I think there was a call to have in-country ambassadors here, and a few people that, got selected, to support in-country advocacy. But when we got down to, working, we realized that we cannot utilize, technological platforms entirely. So we came up with an innovative way, because we have youthful parliamentarians sitting in the Kenya parliament, and they work with a network of youth, grassroots youth initiatives, yeah? So this is the platform that we targeted, and they can easily reach their constituents using the networks they have. So we approached them, and then they were able to connect us with their youthful leaders in their various constituents. And we're using this platform now to always advocate and, try and sensitize communities and also involve the grassroots youth, in NTD interventions. So I think we can ask people to access the website, but I think the challenges that we have in Africa at times, that might not entirely work, but that is what we're doing in Kenya. Thank you.
Thank you for your contributions. So the last one, the lady, yeah.
Thank you. I have to show my visibility also as a woman, like you said. Thank you. It's great to be in this room. I was told this was a youth-led panel. I see it's a youth-only panel. That is something we need to change. Thank you for the experts. I see some experts in the room, including the NNN chair, who are here to support us, but that is something we really need to change. Youths are not only here to discuss with the youths. We need to be heard, we need to be heard by the experts. That is one thing I really wanted to point out, and something that Hooria said very well was to end neglected tropical disease. I don't know about ending the diseases, but I'm pretty sure with the participation here and the conversations going on that we are going to end the neglect from the NTDs. That was all I really wanted to say. Apart from that, we have Youth Council from WHO and Young Professionals Program from WHO, who are always trying to include youth from, especially from those countries who are low and middle income, to be included into the system, to work in the organization. So I just wanted to slip in this promotion as well, that yes, all the organizations need to have such seats, such places for the youths to be a part of, not just interning, but decision making. Thank you very much.
Thank you for your contribution. And from all you have heard from different people, so we have seen that there is a role everyone can play in ending NTDs, whether you are in health sector or in business, or you are in maybe legal sector. So everyone can play a role in ending NTDs. Over to you, Merjin, if you have anything to add.
Thank you everyone for attending this youth-only panel as highlighted. Of course, we're here as youth, and intergenerational collaboration as well as cross-sectoral collaboration is very important. So it's good to see both a mix of youth only and the elderly, or the older, perhaps not all elderly. And the key takeaways from this insightful panel discussion was the echoing of using different strategies in combating NTDs or advocacy for NTDs with the sustainability of storytelling, inclusion of NTDs in training curriculums in schools, and various other perspectives that we heard today. So thank you very much, and if you have any further questions or comments, the panelists are available at the refreshments that will be offered a few minutes from now. Thank you.
Thank you, Mary.